Welcome to Living Well, Ask a Pediatrician. This event is sponsored by PayPal. Are you looking for ways to support your friends, family, or neighbors? PayPal makes it easy to help others who are having a tough time right now. With peer-to-peer payments, you can send money quickly to your loved ones, whether they are nearby or far away. With money pools, you can easily collect funds from many different people to help your community. And with Donate, you can contribute to help support the cause of your choice. Download the PayPal app to start helping today.
Hi everyone, welcome to our weekly Living Well series. I'm Tara Parker Pope, founding editor of Well, the Times Consumer Health section. Today, I'm so pleased to be joined by pediatrician Dr. Perri Klass, who writes the weekly column, The Checkup, for the Times. And she's a professor of journalism and pediatrics at New York University. Perri, welcome.
Thank you. I'm so glad to be here.
I'm glad you're here too. I always so enjoy talking with you. And hello to everyone listening. We want to hear from you. You may submit your questions at any time during this event using the Q&A feature in Zoom. And please tell us where you're writing from. Please note that this event is not a substitute for professional medical advice, diagnosis, or treatment. Please reach out to a professional health provider with any questions you have regarding a specific medical condition. And also, this event is being recorded. So let's get started. Perri, how are you doing? It's so great to see you. What's going on in your life? Have you been completely disrupted by the pandemic like the rest of us?
I think everyone's been completely disrupted by the pandemic, and one of the things that's helping me through is actually being in touch with pediatricians and people who are trying to do that job in the different ways that we're doing it all around the country, and hearing the questions that people are getting from their patients and the families they care for, and the ways that all of us are trying to think through the answers.
Yeah, I thought you wrote a very important column today. I do really feel for the parents of young children. Not only is life is challenging for everyone. Life is challenging if you're single and alone. Life is challenging if you've got a house full of kids. Life is especially challenging if you're a healthcare worker, a frontline worker. But I do think that children, the adults understand what's happening, and children don't always understand, or do they? I mean, tell me a little bit about how children are thinking and what they're capable of thinking when life is so crazy.
Well, it depends on the age of the children, and it depends on what their individual families are going through. Children, I think it's probably safe to say, always understand a little more than we think they do. And that's true whether we're talking about very little children who are picking up intuitive and emotional signals from their parents. But honestly, it's also true about elementary school children, middle school children, high school children, and adolescents. They do probably always understand a little more than we necessarily give them credit for. I think we all know as parents that the younger they are, the more chance we have to give them some sense of security, of routine, even if we aren't always feeling it ourselves. As they get older, we have to be more honest with them, both about what we do and don't know, and also about what we're going through ourselves.
In your column today, it was clear that doctors are getting a lot of questions, and there's not a one-size-fits-all answer. I can't tell you, okay, you can do this, this, and this, and you'll be fine, right?
When I started calling up doctors, pediatricians who are answering these questions about, when can I let my child see another child and under what circumstances, I can't tell you how many doctors said to me something like, well, I've got 2 kids. For one of them, this is a life and death issue. It's the only thing he can think about. The other one, it's not so urgent. So it's different for families, depending on your family situation. It's different child by child. And obviously right now, it's very, very different depending on your geographical situation, what's happening around you. So there certainly isn't any one-size-fits-all answer. And there may not even be a one-size-fits-all answer within the same family.
So today we're going to talk about, quarantine, coronavirus moving forward. But I also know that you've written about talking to children about race. And given the unrest in the world today, I think a lot of parents probably have some questions. You know, their children are going to see things. Maybe they can't go outside in their community, or maybe they are marching with their parents, or maybe they're seeing things on TV that scares them. I mean, what are your thoughts about this conversation we have with our kids during times like this, when we're seeing issues of race and unrest play out on television and on our streets?
Well, I would start with the same pediatric guidance that we give about all complex conversations, which is that none of these is a single conversation. It's not that you wake up in the morning any more than you wake up in the morning and you say, okay, my child is growing up, it's time to have the conversation about sex and sexuality. If you leave it for one single conversation, it's not even thinkable, it's not even possible. So what we're talking about now is being willing to engage with your children, taking into account their age, their understanding, their developmental stage, in a long, ongoing, important conversation that is both about race and racial identity, but also is probably going to be take into account disparities, inequalities, even some of what certainly some of what we're seeing right now about who's getting hit in different ways in this pandemic. And I think the first place you start is, don't think you have to have one conversation in which, even if you had all the answers, you provided all the answers. What you're most importantly doing is saying, I know this is hard, I may not have all the answers, but I want you to hear my values, I want you to hear what I'm thinking, I want to hear what you're worrying about, I want to talk together. And it's going to be the same answer that if you bring up the question of children watching things seeing images in the media. First of all, as a parent, given the age of children, you're going to think about what they should see and how much they should see. But then the next answer from the pediatricians is always going to be, watch with them, talk to them, see what they're seeing, hear their reactions, respond, and let them see your own reactions. For most of us as parents, even when we aren't absolutely sure of ourselves, we want to be sure that our children are hearing our values, our questions, and our doubts. And again, none of these are easy questions or conversations, but you need to be having them, and you need to be open to having them again and again.
Right. Okay, so we're going to start taking some questions now. To everybody listening, you can ask about coronavirus, you can ask about current events, and you can even ask about knitting, because Perri is a great knitter, and I love that that is one of her passions. She also is very involved in national literacy projects and reading in children. I think the first column we worked on together was about reading picture books to your grandchildren, and it was really enlightening, just about the value of sitting with a child in a picture book and what the child can get out of that experience. Do you remember working on that column with us?
Oh, so well.
Yeah. So, okay, so let's take a question from Vivian from Maine about camp. Can you please talk about sleepaway camps? What are the risks versus benefits of sending children away for multiple weeks? Big question.
Big question. And you know, I've actually talked to some of the people who do the policy work for the American Academy of Pediatrics around camps, and everyone is probably worrying about the same things. First of all, some of the issues that you might think about with regard to camps is, are they drawing on a very local group of kids coming from one particular area that's at one particular stage and everything that's going on? Or are they, does the camp have children coming long distances, which brings up the question of the safety of travel, but also brings up the question of, you know, taking into account where people coming from different places that may be at different stages. There's the question of how isolated a camp can be. There's the question of how far from medical attention or how much medical attention is available at a camp. The people who think about camps say, well, the good thing about camp is there's a tremendous amount of outside time. The difficult thing about camp is that it's not a place that necessarily lends itself to social distancing. Some people will say to you, camp is an opportunity this summer to think about ways we might want to think about keeping children safe when school starts again. This is a little bit of a place to try some of those parameters. Other people will sort of say to you, you know, until we've seen what happens just with people staying in place as we open up, how can we think about moving people around and cohorting, putting children in groups? I don't think there's any easy answer. And I think the pressures on people who actually run camps are really very intense right now in terms of asking them to take on kind of writing these scripts and inventing things without clear guidelines and evidence. I just think it's asking a lot.
So let me break this down a little bit. So if I want to send my child to camp, I should pick a camp where I know there's a hospital nearby, a close, you know, there's a strong medical school or hospital in the vicinity. Is that important?
I think what's important is that you talk to the camp and you find out that they have a plan and what their plan is, and you review it as a parent and you say, this plan makes sense to me. And it's not even that I'm saying that the camp has to decide where they're going to send a sick child. The camp has to decide what they're going to do if a child gets sick in terms of all the other children. What's the plan? What's the plan? And I've heard people talk, and I don't know if camps are actually implementing these, but I've heard people talk about the question of, could you ask that everybody be tested for coronavirus at the beginning of the camp, the staff, the campers? What could you do in terms of that? And those would be important questions to think about as a parent, but so would the question of, what happens if somebody does get sick? What's the camp's plan in terms of testing, in terms of taking care of everybody else there?
Okay. And the issue of where do the kids come from? I mean, if I'm living in Vermont, which is a very low case rate, cases are low, the test positivity rate is low, I'm feeling a little more comfortable in Vermont. But if I'm going to a camp and all the kids are coming from New Jersey and New York, that changes things, right? Because they're coming from a place where rates are higher.
Absolutely. That is to say, and you know, and again, everyone's going to have to make these decisions for themselves. But if, for example, you're in your town and you're thinking about something else, which is, I don't know if it's happening, but it's certainly being talked about. Say you're thinking about some kind of sports activity in a town where the children might be able to come, where you might practice social distancing and good hand hygiene. And the other thing you're thinking is, well, this is in my town, we are at the stage we are at all together in terms of the state's rules, in terms of opening up. We know kind of what the guidelines is that affect everybody in town. Maybe that's helpful to you as a parent. On the other hand, if you're thinking about sending your child to a place that's going to combine kids from many different places, that's a different equation. And I think that's, again, one of the reasons it's been so challenging, both for people who run camps and for all the people out there. You know, the pediatricians I talk to, the ones who do camp guidelines, they love summer camp. They believe in it. Most of them are campers and camp doctors. They understand that on the positive side, there are just so many benefits for children, but then you get into these very complicated conundrums, which actually reflect some of the things that are wonderful about camp, that they bring kids together from many different places, right, that they are not obvious places for social distancing because of what goes on at camp and makes it meaningful.
Right. We spend a lot of time on that question, but I get it so often, and camp is what's on every parent's mind. So I appreciate all that. I just want to remind our listeners that you can submit questions at any time during this event using the Q&A feature in Zoom. So please tell us where you're writing from and send us your questions. I have a question from Beth. She asked, now that our summer camp is canceled, what activities are safe for kids on vacations or outdoor activities like the beach best? And I think maybe talk some about backyard fun too, because I know a lot of people are buying trampolines and bicycles, and so let's just talk about keeping kids safe this summer if they're not at camp. What kind of?
So if we start with coronavirus, pretty much everybody agrees that the number one best thing you can do is be outside. So, you know, being outside with your kids, people who are thinking that they're going to take steps toward letting their kids be with other kids, outside is best. And taking into account all the other rules that we've all learned about, you know, good hand hygiene, masks, outside is better. Outside's better for all of us. So if you're going to think about family activities, outside would be where you'd want to start. If you're going to think about maybe taking a step toward activities with other kids, outside is where you'd want to start. Now, then as soon as you say that, of course, the pediatricians come around to say, yes, but. So the sun is still hot. Getting sunburned is still very dangerous, especially for younger children. So go outside, but sun protection, sun protection, sun protection. And then people have started in my field to worry about water safety, because especially for younger children, drowning is a tremendously, it's one of the ways that young children really do suffer and die every year. So we're talking about kids being outside. Are we sure they're going to be supervised? Are we sure that they're going to be, if they're going to be swimming, that there are going to be adults keeping a close enough eye on them? All of the usual precautions that apply. Bicycles, I'm going to say bicycle helmets. Trampolines, I'm going to say trampoline injuries. And I think there's a sense on the part of many pediatricians that just as there's been an extra burden on parents for the last couple of months, both as teachers and as supervisors, that once you go outside, it's really important to keep in mind all of those safety rules.
Right. I do worry about the trampolines, because I think people are looking for ways to keep their kids active. And
yeah,
if you've got two kids on a trampoline and you're looking at your laptop or your phone, that's not supervising a trampoline, right? I mean, they're pretty dangerous.
Or a swimming pool.
Or a swimming pool.
Or a swimming pool.
So something to remember for parents. Okay, a couple questions about travel. We have two that are similar, so I'll ask both and you can answer. Lisa asked, what precautions can parents take regarding airplane travel with their children? This is a 2-year-old and they're considering a trip in August. Related, Barbara asked, is it safe for an 8-year-old in a divorced home to travel from Portland, Oregon on a plane to visit the other parent in Las Vegas and back to Oregon? So planes and children, I mean, planes are a whole other equation, right?
They're a whole other equation. And, you know, one of the hard things about this is nobody's ever going to be able to say, yes, it is absolutely safe in this setting. But I think we're learning more and more about what you can do to bring the risk down. And I think the airlines have shown that they're interested in doing all that they can do to bring the risk down. So those are actually two very different situations. If you're flying with a 2-year-old, I think you still have a fair amount of control. That doesn't mean the 2-year-old is going to cooperate. It may mean that you're going to have to be a little more vigilant and a lot more restrictive on the flight than you would be otherwise with a 2-year-old. You know what I'm going to say. I'm going to say hand hygiene, hand hygiene, hand hygiene. I'm going to say wipe down as well as you can any of the areas that the child might touch. I'm going to say bring a unbelievably big bag of distractors and things for the child to do. I'm going to say relax all your rules about screen time and your 2-year-old. What you would most like to do, right, is get on this flight, keep the child sitting in one place, not touching anything, staring at a screen as long as possible. It's going to be hand hygiene. It's going to be thinking through in advance. Would you be more comfortable having all of your own food with you? And you're going to then you're going to talk to the airline about what arrangements they're making. Would you be more comfortable on a flight when it's least crowded and it can be just you and your family without too many people around you? It's going to be about trying to minimize the risk and keep your child as much contained, kind of with you, kind of trying to bring your bubble with you as far as you can. And then we're talking about an older child, it's a question of how much you feel that child is going to be able, if that child's flying alone, to maintain some of these same rules. Some older children are really the ones who would be able to get on an airplane, sit down, and for a short flight, never look up from a device. It's not what we're trying to encourage at home, but we all know it can really make a difference on an airplane flight.
And I would say wear a mask on the plane. What's your thought?
I would wear a mask on the plane, and I mean, I'm sort of taking that for granted for people going out in public. I would wear a mask on the plane. If you've got a child who's not in the habit of wearing a mask because the child is mostly inside with you and is very young, I would consider practicing if you're going to do that. And I would try to talk it through with a child who's old enough to understand how important that is, and how you can make a game of it. And you can remind your child about hand hygiene, and your child can remind you. I mean, you can make it okay in your family to just keep reminding people over and over again.
That leads to the next set of questions where people are asking about masks for children. I know you wrote a story about this. Do children under 5 need to wear masks when going outside? What about during activities and biking? So we know children 2 and younger are not expected to wear masks, correct? And I think they should not wear masks. Is that right?
That is what I have heard, although, you know, the advice on masks has been changing and has been, you know, I mean, I'll go with what is currently recommended.
Right.
But I think that I have certainly seen lots of children who are under 5 who are perfectly able, you know, who are wearing masks and don't seem to mind it a bit.
What about outdoors? I think that whether an adult or a child wears a mask outdoors sort of depends on what you're doing, right? Outdoors. If you're
if you're outdoors in your backyard with the people who are in your household, I don't think anyone is being asked to wear masks.
What about a bicycle, kid riding a bike in the neighborhood?
Probably you're gonna make that call depending on how likely the child is to come in contact with other people.
Right. You know, go ahead, I'm sorry.
No, you go ahead.
I was gonna say, even adults, you know, when we're riding the bike, we're not at risk, but if we stop and we chat with the person next to us, you know, and then we're stopped and we're having conversation without a mask. So it is uncomfortable to wear a mask, but the question is, how much can you trust your 8-year-old not to see his pals and bike into the driveway and hang out? You know, is the mask a reminder of what's going on in the world?
Masks are really important, and we're all going to get more accustomed to wearing them. But I do want to say that if you have a child who is going out to ride a bike or rollerblade or anything else, you want to make sure beforehand that the mask is not getting in the way of the child's vision. You want to sort of practice, you know, normally you would not wear a mask in the house, but you might want to rehearse it a little bit and make sure the child can see clearly, the child is comfortable. I mean, one of the things which everybody who has ever worked in a hospital knows is that people can do the most delicate, complicated work that they'll ever do. Surgeons can work in masks. You can learn to do pretty much anything in a mask as part of your workplace, but it's not something that you suddenly get used to, that you suddenly feel, I've never done this before and now I'm fine.
Right.
So, you know, again, I just want to say, any child who's doing anything where balance is involved, where you could fall, and you now are thinking that it might be safer because there are other people around for that child to be wearing a mask, you want to make sure to practice and make sure that it's okay.
Especially if they wear glasses, because glasses do fog up when you wear a mask. So I think practicing, I've had to practice with my own mask just to kind of figure out how to just like move my glasses a little forward so they don't fog. So we have more questions, lots more questions. Barbara asks, what are the risks of my 3-year-old seeing friends? He doesn't understand social distancing as much as other children, older children. He misses his friends, and I'm afraid keeping him isolated is worse than the risk. This is the big question, play dates, for especially little kids.
It's such a good question, and we're all thinking about it. We're thinking about it for our children. We're thinking about it, honestly, for our own family, extended families. We're thinking about it for ourselves. There's no one-size-fits-all answer. I'm going to go over what you all know are some of the things that you're weighing. You're weighing the question of how vulnerable your own family members are. You're weighing the question of whether there's somebody living in the household who is especially vulnerable if an infection comes back to the household. That matters a lot. You're weighing the question of whether you've got another family you think you really can talk this through honestly, feel comfortable with their level of social distancing, feel comfortable with what they're doing so that you can get together. And then you're thinking about how much supervision is actually possible. And, you know, you could try, even with a 3-year-old, to start with something which is with a family that you've talked through this through very, very, very thoroughly, and you all agree on the rules, and you all have the same sense of safety. That was outside, and where there was at least some attempt on the part of the parents to keep some social distancing, and you could think of that as a first step. It's not going to be the same because it's the risks that you're feeling at home, it's your own level of comfort, and it's the question of whether there is, in fact, I mean, none of us think that we're going to go from social distancing, from being home alone with your child, to back to some kind of large play group. But I think all of us are thinking about what would be the first step with which we would feel comfortable.
And it depends on the communication you have with that family. It depends on whether you have a vulnerable person in your orbit who would be more at risk. Opened up your bubble. So it's very much an individual decision. Let's talk a little bit about childcare. I'm going to try to move through these questions a little faster so we can get to as many as we can. Donna asked, when is it safe to bring a babysitter into our home? What kind of precautions can I take, and what questions should I ask her? So it's this idea of just opening up your home to an outside person to, you know, this is an important relationship, children and the care providers that they're used to.
It's a very important question, and I'm afraid my answers are going to start to sound a little bit similar, in the sense that you want this, if you are even contemplating such a thing, you want it to be someone with whom you feel comfortable being really honest and open in terms of having a conversation. You're probably going to be wanting to talk about some of the things in terms of how that person is living and practicing, which you're going to feel like you need both to be able to ask and to be able to tell. You're going to want to talk about what your own family's level of comfort is. You're going to want to ask, you know, how careful are you being? What else? What are the other exposures in your life? You're going to, one of the questions which all of us are going to need to think about probably in many, many, many settings in our own workplaces is, are you comfortable sort of talking about the question of testing? Are you comfortable talking about the question of, obviously one of the most important things we're all going to need to learn and also talked about with people who work for us is obviously if you're sick, if there's any question you might be sick, you're not, we're all going to have to learn. This is something doctors have had a lot of trouble learning. Don't come to work if you're sick, or even if you might be sick. You know, all of these are subjects which we all are going to have to be able to be much more straightforward about than we used to be. The other question that's going to come up with anybody who's, you know, working with children nowadays is, what about the social distancing issues, which, as we all know, are difficult with children. But are you asking someone to wear a mask even in your home? Are you sort of asking people to practice extraordinary hand hygiene? There's not going to be a single set of rules. There are going to have to be sets of rules for childcare centers. And we're going to learn a lot, I think, from watching what happens in group settings and what works. But I wish I could get of ideal rules, and we don't have them. Again and again, I'm going to have to say again, it's also going to vary according to how vulnerable you feel your own household is. If you've got an older family member or an immunocompromised family member, young or old, in the household, if you've got someone with an underlying condition who you think is at special risk, then you're going to end up feeling much more cautious about opening up your home to anyone coming in from outside. And you know that already. Sorry.
One of the questions I would ask if I had a babysitter coming in, like a nanny, a regular caregiver, I would want to know how she or he was getting to my house. I would want to, if I had a car, I would maybe offer to drive them back and forth, or, you know, are you taking public transportation? Do you have another way to get here? Because that increases exposure. I would ask questions about what are the number, you know, what's a week like in your life? Who are the extra contacts in your life? Are you, you know, do you have a teenager who's maybe running off to see friends? I think you've got to ask. There's got to be a lot of communication so you can understand, you minimize risk the fewer contacts you have in your life, right? If you limit the contacts, you start to shrink risk. And so that's kind of where I would focus my comments with the babysitter, your contacts, your transportation, and try to support him or her, you know, try to offer transportation, try to, you know, promise them paid sick leave so that if you have sniffles, don't feel bad, you need to, you know, I will still pay you. Those are you've got to build that trust with your caregiver, right?
Well, and I was actually thinking of it, I have to admit, the other way. That is to say that you want to be able to be open and honest with your caregiver. I need a caregiver because I am a doctor or
Sure.
a hospital worker. You're going to be coming into my house. I need to be, yes, I think that's a great idea to be sort of thoughtful about how someone is getting there, but I think you also want to be open and honest with that person about the level of exposure that exists in your household, because the person who's coming to work for you as a caregiver may also have that vulnerable family member back home and is entitled to know how open your household is or plans to be. And this is all going to get much more complicated for all of us in the fall, if and when schools reopen,
Right.
because then everyone with a school-age child, there's going to be more exposure there. And again, this isn't to say this is bad, but I think we have to respect the idea that when someone is coming into your household to work, we now need to have a conversation both about what exposures that person might be bringing in and what exposures that person might be encountering. And again, you're going to want to feel there's honesty. If something changes, you're going to want to be honest about it. You're going to want the person who's working with you to come to be honest about it. And you're going to have to, we're all going to have to work this out together.
Right, right. Great answer. Julia says, let's try to move a little more quickly. Julia says, my parents would like to see their grandchildren and help with childcare. Is using them any more risky than sending kids to daycare or using a babysitter?
Well, I guess the question is risky for whom?
Right.
Riskier for the grandparents, and depending on how completely sure you are that the child has not been exposed, you know, the question is, given the age of the child, how much are the grandparents going to be exposed? How much do they mind this? I mean, I have to say what we're all thinking, which is that for the most part, if you're thinking about a babysitter, probably you, the parents, are going out. And maybe you're just going out for a very long solitary run and it doesn't increase anyone's exposure. But if you're going out into a workplace or you're going out into a social setting, then there is some increased exposure for the grandparents or the babysitter because you, the adults, are taking advantage of that childcare time to do something which increases exposure. This is, for grandparents, on the other hand, there is the incalculable joy and benefit of spending time with grandchildren. People are going to have to talk about this honestly.
Yeah, I do think that I wrote a story about grandparents and how they could see their families, and the comments on that story were painful. There's a lot of loss and there's a lot of sadness by grandparents who feel very isolated, that they're not contributing, and the adult children are very worried about the grandparents' health. Grandparents think that there's no way to live, and I just think that adult children and grandparents have to have a conversation about their goals, their priority, how to keep everybody safe, not just the kids, but definitely the more vulnerable people in that equation are the grandparents. You know, mask wearing, outdoor activity. It's tough though. I feel for people. There's a lot of pain out there among the grandparents, for sure. Okay, so we've got a question here about healthcare and mental health. Lila asks, is it safe for children to start seeing the dentist for checkups? Talk to me about dental checkups and just physical checkups, you know, immunizations, all of that.
I mean, I'm going to give the immunization plug. I mean, yes, please, please, please call your pediatrician. Feel free to call your pediatrician and ask, what are you doing to make things safe? You're gonna, here's what I can say. You're gonna be really impressed by the amount of thought and care and attention that is going into making pediatric offices and pediatric clinics safe right now. They are going to be the most thoughtful settings that you will encounter, because we are all so worried about kids who are not getting immunized, about the possibility of other infectious diseases turning up in this terrible setting. So yes, please, please call, talk to us, ask us questions, and take advantage of us. Now, I think that I would say the same thing about a dental office. Call them up. Say, what are you doing? How safe can I feel? How are you making this as safe as possible? But I think that one of the things that we're really learning is that if you're careful and conscious in healthcare settings, you can really reduce spread. Talk about a place where everybody is going to be wearing masks and more. Talk about a place where we're going to be sanitizing and scrubbing. Having said that, if, you know, most pediatricians right now are also open to doing things that are not involving immunization, that do not involve physical complaints, or even sometimes that do over phone and video. So just, you know, don't be afraid to ask, don't be afraid to say, this makes me anxious.
Right.
Do you think this needs to happen now? Could this happen in a month or two? I think everybody understands that those are the feelings that parents have, and you'll get an honest answer about, this really should happen now, this could wait.
And I think that the dentists are taking on most of the risk. They're going to be wearing the PPE, but when, you know, I've talked to dental offices, the dentist is the one sort of drilling and getting, you know, your germs. They're completely covered and protected. I do think that you've got to call your dentist office, because I've talked to people who called and the dentist is not taking anything other than emergency appointments right now. It also depends on what's happening in your community. Communities that are really more open, that have very low case rates, they're going to be more open. Manhattan is not there yet. You know, New Jersey, not there yet. Pennsylvania, not there yet. Let's talk a little bit about the mental health issue. Wendy asked, do we know more about the mental health impact for young children in the future? Not being able to interact with their peers, learning behaviors like always staying 6 feet apart. I know we don't know, but what do we think about how the long-term effects of all this on children?
We don't know. And again, it's not going to be a one-size-fits-all answer. A child who's been isolating at home with 2 siblings is in a very different situation, right? That child has not been in a group of children of exactly the same age, but there's probably been a fair amount of rough and tumble. There's probably been a fair amount of physical contact, at least in many sibling groups. So it's a very different situation for different children. And that's a hard thing to say. We do have some information coming out of Europe, coming out of Spain, coming out of Italy, where we are hearing from colleagues about anxiety, about sleep problems in young children. Is that going to be a long-term issue? That will probably have a lot to do with how thoughtful and wise we are about responding to it, even in the short term. I think for very young children, the message is still, we're worried. Everyone's worried, but you as parents have tremendous power to reassure, to help, to comfort. I think that for the older children who are more aware and more worried, and who are going to have to, with all the rest of us, live through whatever comes in the next month or so, we don't have answers. But it's also true, I mean, we have to worry about them, we have to care for them, and we have to respond to their questions as best we can.
Sort of along the same lines, Rebecca asked about social opportunity. What social opportunities can I offer my 10-year-old? Sounds like this might be an only child. How can I encourage her to create her own fun despite the loneliness? So how, you know, it's true, especially these only children that are really by themselves and not with other little kids. My heart breaks for them.
I think some of it we have to ask them what they want, what would feel best. We have to take advantage of what is generally their greater ability to think about the potential of screen time. And, you know, pediatricians for a long time have been the ones pushing back on a lot of screen time. And now, as just like everybody else in the world, just like all of us here right now, we're recognizing some of the interactive potential, some of the things you can do with your friends, with a peer group, with other people who have the same interests with you on the screen. And then the other thing I would say, and you know, parents are doing so much. The last thing any of us want to do right now is give parents another assignment. But I would say that if you can find as a parent, if you can keep an eye out for those special rituals, those special activities, those things that you can do together. And I'm not saying a vast, incredibly impressive art project, which nobody else can do. I'm not, although there are parents who do those things, I'm saying look for the small rituals, the reading together through a book, maybe a book about a long time ago when people didn't have all of the same entertainments available to them, something that you do together, something that you'll always remember that you did together, something small, something that happens again and again, and be there for your child and acknowledge the loss and acknowledge the grief.
It's tough, it's tough. You know, I'm getting some questions about schools, and it is hard for me to get my mind around how we're going to get kids back to school, even though we need to get kids back to school. What are your thoughts about the fall? What can we expect as parents?
I think we're going to know a lot more. I mean, just because other countries are doing this first. We're seeing this happen in Europe, in European countries. We're seeing this happen in Asia. We're seeing different kinds of adaptations and different kinds of engineering. And we're seeing countries that are really making a tremendous effort to track and test what's going on. I honestly think we're going to know a lot more. I think we're going to be able to do this carefully and mindfully, and I think we're going to have to do it. Children are going to need to go back to school, and we're going to have going for us the advantage that we're going to have watched other countries do this.
And I can tell listeners that, you know, at the Times, we're certainly going to be on this story and writing about it and giving people guidance and advice for going back to school with Dr. Klass. I'm sure this is going to be a topic of a future column for you. So I'm happy to say we have one knitting question. Who knew? Carol asked, do you feel like it is safe to purchase new wool, either online or in stores? I guess we're worried about maybe something other people have handled. How are you getting your knitting supplies?
I think it's fine to purchase new wool. As with anything else that you buy, if you're anxious about this, you can let it sit for a little while after it comes into your house. Unless, I mean, I certainly know the feeling as a knitter of, you know, buying some wool and being so excited that you can't wait to get home and use it. But honestly, if this is something that worries you, you can buy it and let it sit for a while. But I think that, you know, of course, it's the beginning of the summer, so maybe not wool, but I think that knitting and crafts mean so much to so many people right now.
Be a great time to teach a child or a grandchild how to knit, I would think. Let's end on a sort of looking forward note. What gives you hope? What makes you feel like we're going to be okay on the other side of this? Sort of, you know, the resilience of children, just the intelligence of the sign. What is it that you kind of cling to when you're trying to stay positive?
Everything that children learn, especially young children learn, they learn in the context of relationships and attachment. There's no technology and no expertise that matters as much as the power of attachment, of the strength of the relationship between you and your child, between a child and the adults who are central in that child's world. I think that even in this harsh and terrible time, we are hearing over and over again about the strength of that attachment, about the ways that families isolated in their homes have found to put their arms around their children and reassure them and talk to them. And all of that is teaching, not just the stuff that goes on around the assigned lessons. Every time you answer a child or answer a child's implicit question or read to a child or talk to a child or come back with a familiar ritual, you are teaching. You are teaching that the world is responds, you are teaching about attachment, and your child is learning. And I think that's there, and I think we've seen it over and over again, even in this very difficult time.
Well, I appreciate those words. Thank you so much for joining today. I hope you'll join us again as we go back to school, because we're going to need you then. So thanks to Dr. Perri Klass. Thank you.
Thank you.
It's always great to see you. This event is a weekly series that takes place Mondays at 1 p.m. Eastern. Next week, I'm really excited. I'm going to be joined by Professor Aaron Bromwich. He's an expert in immunology and biology. He wrote a viral blog post about how to think about risk. Have you seen this, Dr. Klass?
Absolutely.
The risk, know them, avoid them. This post was seen by 18 million people and counting. Dr. Bromwich takes a practical, science-based approach to staying safe and still having a life during these uncertain times. So I think you'll find his advice incredibly helpful, and I hope you'll join us next week. To find out more about our full slate of digital events, please visit timesevents.nytimes.com. There really is something for everyone. It's all free. I go there all the time. I watch lots of stuff, so check it out. And finally, we want to give a special thank you to all of our subscribers. You make our work possible. We look forward to speaking with you again. So Dr. Klass, thank you. Stay safe, and thanks for being here. We'll see you soon.
Thank you.
Take care, everybody.